My name is Dr. Anil Vaidya. I am with the Center for Liver and Multivisceral Transplant at the Apollo Hospital in Chennai. Today being the World Diabetes Day, my colleague Dr. Nitya Kalyani and me would like to share with you what is new and exciting for the treatment of diabetes in India. Now, diabetes, as you know, is a disease where there is a lot of sugar in someone's body, and the inability to control the sugar is what causes a lot of problems in three main organs. One is the eyes, one is the kidneys, and one is the nervous system. Diabetes has a long history of being recognized for the last 100 years as a problem. And in the 1920s, there were two people that came up and solved that problem by creating the insulin molecule. However, they made a life-threatening disease into a chronic disease by treating diabetes. And we are now looking at a situation where we can actually change the paradigm of treatment to curing diabetes. And I would let my colleague Dr. Nitya Kalyani to give us a few insights into what we are doing in terms of trying to cure this dreadful disease. Nitya.
Yeah, so as he rightly mentioned, we are on the World Diabetes Day. So we all know that India is the diabetic capital, and we have more diabetics than any other country in the world. So here today on the World Diabetes Day, I would clearly say that the word mantra of controlling the diabetes is there through anti-diabetic medications or through insulin pumps. But we believe and we are looking forward to have the word called cure, so that we can totally eradicate or come out of this problem. So islet transplantation, I would say, is the word to cure the diabetes. And here in India, there has been no initiatives taken till now. So we believe and we are planning to start the islet transplantation program in India. And I would we are very much proud to say that there are only 14 islet cell isolation labs in the whole world, and with none in India or in Southeast Asia as of now. So by bringing in the islet transplantation and progressing by taking experimental initiatives on the initial phase and then progressing towards the phase 2 will help us, and of course the process will eventually implement the whole practice into the normal routine clinical practice.
That's well said, Nitya, but what we also need to realize that replacing islet cells in many parts of the world is a standard of care, and it is up to your initiative in India now that we're looking at making islet cells part of the routine treatment in terms of curing diabetes, rather than stepping away from just having insulin therapy. We would have selected amount of patients that fulfill all the criteria for transplantation, because transplantation of islets also needs immunosuppression. It needs lifelong immunosuppression.
Right.
So it is a therapy not for all diabetics, but very, very carefully selected diabetics who would benefit from something that you are starting. It is a very exciting period for India, because this, as Dr. Nitya said, is the first isolation center for India, not only for India. If you go west, the closest one is in Germany, and if you go east, the closest one is in Melbourne. So there's a whole black hole between these two geographical locations. So considering India having 90 million diabetics and about 9 million are type 1 diabetics, I think we could possibly start a process where we can actually address the problem of cure rather than just treat them. I agree to the fact that we may not be able to treat 9 million diabetics, but as I said earlier, it's got to be carefully selected patients who may find a lot of benefit from this treatment. Apart from islets, which Dr. Nitya is doing, we are already in the process of transplanting solid organ pancreases, which again worldwide is being done on a regular basis. The first one being done in 1966. However, India has been a bit of a backstep in adopting this new organ transplant. Tamil Nadu, with its great organ sharing network with Transstan, has allowed us to start up this new service, and we're proud to say we're possibly the biggest pancreatic transplant center in India today. However, there's a long way to go, and with islet cells going parallelly, I think it would be a very good composite program looking at both islets as well as solid organ transplant to help cure these people. On behalf of the Center for Liver and Multivisceral Transplant and our Department of Islet Cell Transplant, we would like to thank you for listening to us on World Diabetes Days and our update on islet cell transplantation.
Thank you very much for listening, and happy World Diabetes Day.